All right, party people, let's get it. Today, we're going to be covering some slides that you have to know for histology for step one. You're not expected to be a pathologist or histopathologist or anything of the sort, but there are some images that you need to be able to recognize, even with a minimal amount of information provided. So if I give you a 45-year-old dude and a pelvic mass, and then hit you with this slide, you have to recognize that that is chondrosarcoma. This shows up on the exam repeatedly. You just have to know it. So the way that they describe this image is that it is lobulated, meaning that there's the presence of lobules. They look clear, and in the background you can see hyaline cartilage matrix. This makes sense because it's chondrosarcoma, meaning cancer of the cartilage. So features are lobulated cells on hyaline cartilage background. And you need to be able to click this and get out of that question. So key fact for chondrosarcoma, it's the number 3 most common bone cancer. This is after multiple myeloma and osteosarcoma. Typically occurs in males between 30 and 60 years of age. Obviously, it can also occur outside of this range, but just know that these are the associations they want you to know. It can be associated with other diseases like Paget's disease or Paget disease. And don't worry too much about demographics, just focus on the slide itself. Now, next up, here is a slide for multiple myeloma. In this slide, I want you to recognize the plasma cells. The histology looks very different. The buzzword you need to be familiar with is clock-faced chromatin inside the plasma cell. This is a buzzword that they might give you, all right? If they were to give you multiple myeloma, they'll give you someone with hypercalcemia due to increased bone breakdown. They might give you back pain, age over 50, increased ESR, that's because of the rouleau formations, that's the stacked RBCs looking like coins, and lytic bone lesions. If they give you a dude in his 50s, with back pain and increased calcium, you have to know that the next best step for this would be serum protein electrophoresis. This typically would show an IgG-M protein spike. All right, next up, this one is for osteoid osteoma. Will be described as bony trabecula with osteoblastic rimming. What you have to know for this in terms of clinical correlation is that it's very high yield to know that the pain from osteoid osteoma is relieved with an NSAID. This is classic. If you see a vignette with localized pain that improves with NSAIDs, this has to be on your differential, that being osteoid osteoma. Next up, we're going to give you osteosarcoma. This is the second most common bone cancer after multiple myeloma. And this typically affects males aged 15 to 35. Obviously, it can also occur in older patients with Paget's disease or with familial retinoblastoma gene, RB gene mutation. So for instance, they might give you a kid with enucleation of the eye or a white pupillary reflex known as leukochoria and might later develop osteosarcoma. 2 radiologic findings that you must know is Codman's triangle. This is periosteal elevation due to the tumor. Think of the tumor literally pushing the bone up and away from the main part of the bone. And the sunburst appearance. This is the spiculated new bone formation. Now, they're not going to usually give you quote-unquote sunburst appearance. They might just describe it as spiculated new bone formation and then say that there's no periosteal reaction to rule it out. Next up, we're going to give you prostatic adenocarcinoma. So basically for this image, I want you recognizing the glandular appearance. Now, you're not expected to know this image just by looking at it. You're not a pathologist, but I'm showing it to you so that you're familiar with it, so you don't get caught off guard. Now, metastatic prostate cancer is very common in older males, and this does show up on USMLE questions. Just remember, prostate cancer appears glandular, and this is not the same as the cartilage background and lobulated cells in chondrosarcoma. The key takeaway is that you need to be able to recognize chondrosarcoma. It pops up over and over again, so just know that image. That's it for this one. Go crush it.